Hello, I'm Janice Karen, Director of Policy, Technology, and Innovation at the Massachusetts Health Data Consortium, or MHDC. I run our Data Governance Collaborative, also known as the DGC. We start each of our weekly meetings with a series of industry quick updates to learn about new and proposed regulations, laws, standards, industry initiatives, and other activity. Join us for this week's updates. And if you'll go to the first update, please. So CMS posted draft guidance last week on reading ECQMs and reporting logic for the 2026 reporting period. This is an annual update that they always give the option to comment on. The comment period was very short. It was opened last week, I believe on Thursday. And it only runs through March 3rd. My guess is it got delayed because of the administration change, but they didn't want to change the deadline date. We did comment on the draft guidance for reading ECQMs last year and looked at both documents. It's unclear how much they change year to year, but if you'd like to take a look at this year's drafts, you can find links to them as the first two links, and our comments from last year is available at the last link. Any questions or thoughts there? All right, let's go on to the next update. Excuse me. So the White House has created a new Make America Healthy Again commission with the following goals: redirecting national focus towards understanding and lowering chronic disease rates and actually ending childhood chronic disease. I don't know if we'll be able to end anything, but certainly making progress would be a good goal. And also adopting fresh thinking on nutrition, physical activity, healthy lifestyles, what they're calling over-reliance on medication and treatments. They did not explain what they meant by that. Effects of new technological habits, environmental impacts, and food and drug quality and safety, as well as increasing transparency of data. So they included a few policy mandates in the executive order, which is that all federally funded research needs to leverage transparency and open source data. They should also avoid conflicts of interest that skew results and or perpetuate distrust. Again, that could have multiple meanings depending on your outlook on life, so that may be an interesting one. And then the NIH is supposed to prioritize research on the root causes of illness. Let's keep going. If you go to the next slide. So they're also mandated to work with farmers to ensure that food is the healthiest, most abundant, and most affordable in the world. That is more or less an exact quote. And then also, here's one that's interesting for us. Ensure the availability of expanded treatment options and flexibility for health insurance to cover lifestyle changes and disease prevention. So that's going to be interesting to see where that goes. So key commission members include the Secretary of HHS as the chair, the Assistant to the President for Domestic Policy is the Executive Director, and then about a dozen other cabinet members and senior White House advisors are named in the executive order. Some of the cabinet positions include agriculture, education, basically the things that do seem mostly in line. There's also folks like the director of the OMB and financial people. So it seems like from a cabinet level, at least, it's mostly the right folks in the room for these types of discussions. So the first order of business for the commission is fighting childhood chronic disease. And they are tasked with studying the scope and causes of the problem, advising the president on how to inform the American people about the scope and causes, and then to provide government-wide recommendations on policy and strategy. Any questions or thoughts so far? All right, we've got one more slide. So what exactly are they going to be doing? So in the first 100 days, the commission is going to compare childhood disease status in the US versus other countries, assess threats from environmental, food, medicine, and other factors, report on best practices for prevention, evaluate nutrition, exercise, and mental health educational programs, identify and evaluate existing federal programs and funding for childhood disease treatment and prevention, ensure transparency of all current data and unpublished findings as legal. That one also has the may be interesting. Unpublished findings. Interesting. Eliminate undue industry influence and increase methodological rigor. I can speak in research. And then establish a transparency and ethics review framework. And that framework is meant to cover industry as well as government. So that's what's been mandated. And then within 180 days, the commission is supposed to come up with an official strategy for all of this. You can read more at the link provided. They don't go there is some more background information and some additional details about some of this, but they don't go into a lot of specifics about what certain things mean or exactly what they're looking for in certain areas. So any questions or thoughts or comments there? All right, let's go on to the next update then. So ASTP has put out its 2025 updates to what they call the SAFER guides. And these are a series of guides that promote EHR safety. And they were originally published in 2016. The original 2016 versions are part of various programs across HHS, including the Medicare Promoting Interoperability and the MIPS payment programs. There are 8 guides in 3 categories. The specific guides haven't changed. Presumably the content within them has. So there's foundational guides, which are high priority practices and organizational responsibilities. Infrastructure guides, which are contingency planning and system configuration. And then clinical processes guides, which are around patient identification, computerized order entry, test result reporting and follow-up, and then clinician communication. So each of the guides includes some background information about the topic, and then the bulk of it is a series of interactive worksheets that can be filled out to evaluate and improve your EHR practices. So you can find both the old and the new guides at the links there if you're interested. Any thoughts there? Well, I'll just make one other comment. It's since they're almost 10, the old guides are almost 10 years old. It seems like they were due for this update. All right, let's keep going then. So Gallup has put out their annual survey exploring Americans' concerns about health and the healthcare system, and they were kind of interesting. The top 3 concerns were healthcare access and affordability, which was named as a top concern by 25% of the respondents. Food and water safety, 18%, which is new, has not typically been near the top of this list in the past. And reducing chronic disease, 11%, which is what we were just talking about with the President's Commission. So food and water safety was #1 for Republicans, more than any of the others. And so that's interesting because that's one of the things that Secretary Kennedy talks about a lot. So there's definitely picking up on some of that. However, there was a lot of bipartisan agreement in different areas. People of all political parties prefer that the federal government, rather than state governments, act on health issues. And that was 60% of all Republicans who responded and 75% of Democrats. 30% of respondents thought that strengthening safety net programs, which includes Medicare and Medicaid, but also things like federally funded health clinics and stuff like that, should be a top 3 priority. This was higher for Democrats than Republicans, but still a significant note for everyone. 13%, only 13% indicated that retaining access to reproductive health care was a top 3 issue. So what I believe people were asked to do was rank their top 3 issues. So that's interesting because obviously it's something that a lot of people care about, but it didn't make it to the top 3 for a significant portion of people. And then the top 3 most trusted source of information were people's providers, research studies, and the CDC. But the relative order of the 3 varied a lot by age and other demographics. Those were the top 3 for most folks, but just how they ordered and what percentage was where the variance was. So I thought this was pretty interesting. You can find more information about the survey at this article. And I thought this article was actually pretty interesting, so I used it rather than the bare survey results. Any questions, thoughts, or comments about any of this? All right, if you'll go to the next slide and pause there. I hope you learned a lot from our quick updates. If you're interested in finding out more about the DGC and its other activities, email me at dgc@myhealthdata.org. That email address is also on your screen.